Good afternoon, everyone. This is Mariusz speaking from PIARC General Secretariat. Welcome to our online seminar, webinar on the impact of the COVID-19 crisis on road safety. Thank you, everyone, for joining us today. Our speakers include John Milton from the USA, Washington State DOT, who is the chair of our Committee on Road Safety, Rob McInerney from iRAP, who is also a member of our Road Safety Committee, Jun Takeuchi from Japan, who is a technical advisor seconded to PIARC, Mariusz Kieć from Poland, who is with the Cracow University of Technology, Jaime Campos Canessa from Chile, who is from the Dirección Vialidad, and Christos Xenophontos, USA, Rhode Island's DOT, who is the chair of our Committee on Performance of Transport Administrations. A couple of housekeeping principles. Please keep your camera and your microphone turned off. You are very welcome to ask questions. At the end of all presentations, Christos will check the chat and ask questions to the panelists. More on that later. We'll only be able to answer a limited number of questions due to the large number of participants. A tip, if you find that the chat window is too large, you can just close it in order to see the full presentations. So, introduction to the webinar. I'm Mariusz, Secretary General of PIARC. Basic rules again. So I hope you're all accessing this seminar from a device that allows you to see visuals, such as a laptop or a tablet. Please mute yourself and keep the video turned off to avoid background noises and connection overload, maybe. Please ask questions. And also on the right side of the screen here, please be sure to have your full name and country displayed. We're not using the features such as raising hands and similar. So if you want to do something or ask questions, please do that in the chat or using the Q&A button. So first of all, it is really, really welcome that you ask a question, that you raise an issue, or that you share a practice. This is really encouraged because this is really one of the objectives of our webinars. Of course, only questions specific to roads or road transport. There's a button on Zoom, which is the technology that we are using, called Q&A. It's probably called differently according to the language, to your language. If you want to ask a question, you can do it there. If you want to direct the question to a specific panelist, start with question to Mr. or Mrs. X and use the English language, please. We have other webinars in French and Spanish, but today we use English. You can also use the chat feature of Zoom, which is under the 3 dots button to the right side of the menu bar. Then in that case, send a message to all participants, which is one of the options. Those channels are monitored by Christos Xenophontos, and he will direct the questions later. And as I was saying, we don't use the raise your hand feature. About your name in Zoom, I guess everyone here today has already made sure that their name is properly displayed. It should be first name, last name, and hopefully country, if you can do that, because this really fosters interaction between participants. Speaking of which, the seminar is recorded and we will make the video public on PIARC's website and on our YouTube channel after the webinar. We will also share the PDF file of this presentation in French, English, and Spanish. What's the key concept? We focus on the short term here. So the world is going through a crisis and every day counts. It's urgent to share knowledge and practice among PIARC member countries to provide support in near real time. There is knowledge and practice that is not yet confirmed valid or effective because really time has been too short to have an in-depth analysis and other quality insurance practices, but a good idea now can save lives, can improve business resilience, and could help you minimize disruption of service. Please note, nevertheless, that what works in one country may not work in another. We don't know, but it can inspire you. Note that we're also at PIARC working on the medium and long term for when the pandemic is in a manageable state and substantially under control. This leads me to the disclaimer. Time is of the essence, and it's likely that knowledge and practice shared today will not have been officially approved by each country's official authorities. Maybe it will, maybe it will not. This is why we have to say that the ideas and examples shared here are for illustration only. They do not necessarily represent official policy. They will be subject to further evaluation, and they will be used in deriving recommendations on policy and practice in due course. Care has, of course, been taken in the preparation of the material, but no responsibility is accepted for any damage that may be caused. So our speakers today, I've already introduced them, and thank you very much to them for having made themselves available today and for having prepared excellent presentations. So the structure of our session will be a brief introduction to PIARC and to issues faced by road operators and administrations, then panelists' questions, then question and answers, then conclusion and next step. And I see there's lots of remarks on the chat already. Don't forget, if you want, you can use the chat and it's really welcome. If you want to ask a question, please use the question and answers button in the middle of the menu bar. So, short presentation of PIARC. What are we? Who are we? PIARC is the new name of the World Road Association. Many of you are familiar with that name because we were founded more than 110 years ago as a non-profit, non-political association. Our goal is to organize exchange of knowledge on all matters related to roads and road transport. We have 124 member governments, as well as regions, groups, companies, universities, and individuals. And we are the first global forum for the exchange of knowledge, policy, and practice on roads and road transport. This leads us to 4 key missions: to be a leading international forum for the analysis and discussion of the whole spectrum of transport issues. This is what we're doing now. Actually, this webinar really aims at discussing road safety issues in the framework of the COVID crisis. We aim at identifying, developing, and disseminating good practice and giving better access to international information. For example, we publish reports that you can download from our website, on average 1 new report every month. We consider within our activities the needs of countries with developing economies and economies in transition fully. We invite experts from those countries to express needs that we will analyze. We invite their experts to join our committees, and we organize seminars in those countries. And last but not least, we design, produce, and promote tools for decision-making, such as HDM4. Many of you may be familiar with that software that helps in making decisions related to road investments, or QRAM, which helps with transportation of dangerous goods in tunnels. We do that through the experience and knowledge of 1,200 experts from more than about 80 countries currently, in 22 committees and task forces. If you want more information, I direct you to our strategic plan, which guides our action over 4 years, and it's available from our website. On that website, you will find here in Spanish, but it's also available in French and English, obviously, a dedicated web page where you can find the recordings of the online seminars on COVID-19 and roads, more than 15 so far, the presentations of these webinars, as well as reports related to pandemic management. And you have screen captures of the cover page of those reports, such as risk management for emergency situations. 2 notes on the COVID-19 crisis are already available from the website. They present the emerging findings from the first webinars. They are relevant for the road community and may be useful to inform planning and operational decisions that you have to make on the ground urgently. They're available from the website for free in English, French, and Spanish. So what are those issues, actually? We have identified a series. Well, there's many issues, of course, but we're trying to structure them for better legibility. All of us need to ensure the health and safety of our employees and road users. It's true of any organization, but it's also true of road operators, road administrations, and probably all of you in the room. So how do you do that? And it was in the early weeks in March very important to share best practice on this. It still is. You need to maintain activity and continuity of service. Maybe you have employees working from home. Maybe you have, unfortunately, employees who have been ill. How do you maintain activity? How do you keep your roads open? How do you maintain road safety inspections in those circumstances? You have to respond to the impact on transportation. In many countries, we've seen decreasing traffic levels, which may mean decreasing revenues. decreasing traffic levels may mean that this is a good time to conduct roadworks, for example. You need to be able to handle that. A reminder to everyone, we don't use the raise your hand feature. You need to manage the impacts on the economy and supply chains. Goods providers, food chain members able to deliver their goods, you need to push medicines through the channels and drugs so that people can use them. In a later time, you will need to revive the economy after the crisis, because roadworks has been proven as a very effective way of speed boosting the economy, for example. You also need to maintain relationships and collaboration with customers, users, and all interested parties. In many cases, governments and administrations, civil security organizations will give us directions about how to handle things. Maybe in some cases, borders will be closed, but you will need to manage transportation of goods nevertheless. How do you handle that? And we have had a really good webinar on freight some weeks ago. Security is an important issue. I'm not talking about road safety. Security in particular has been, there's not a day without major bad news about security in a part of the world or another, such as cybersecurity. Nowadays, many people work from home, maybe from laptops that are not fully secure, maybe using Wi-Fi networks that are not fully closed. How do you handle that? Those are all the issues that we have tried to cover. I refer you to webinars on freight, on ITS, Intelligent Transport Systems, on urban transport, that are available from our website. But today will be about road safety, and this is why we are really excited to have panelists today. And we'll start with John Milton. John is the chair of PIARC's Road Safety Committee, and he will share with us the experience in the US and some insights about the road safety manual of PIARC. John, thank you very much.
Thank you very much, Patrick. What I'd like to do today is discuss a bit about the United States and then delve a little bit more into sort of the overall impacts and comparison of the US to the EU in at least a couple of locations. Then I'm going to talk about Washington State and its individual impacts and how we're carrying out and dealing with the issues of COVID. And then I'll wrap up and tie it into the road safety manual, which I think is a very important aspect of how we manage and deal with crisis just like this. So next slide, Patrick. Just a little bit background about me. I am the chair of the TC 3.1 Road Safety Committee. I am an employee of the Washington State Department of Transportation, and I'm the state safety engineer. I also am vice chair of the American Association of State Highway and Traffic Officials, as well as I have 32 years of road experience. So next slide. What we found in the US was quite interesting. So states, just to give you a perspective, in the US, the states operate with guidance from the federal governments, but each individual state can take that guidance and use it as they wish through the executive authority of each state's governors. We have 50 states, and there's plus 2 territories that we look at. What you can see from February 29th is a very significant drop in traffic overall. But as we're coming into July and August, we're seeing a lot of reversal of that traffic drop throughout the US. So what has that meant for us? Next slide. So what we found as of April 11th, this is a look at the United States. So the darker the color, you'll see is those places that are locked down, and yellow color would look a little bit more like it's open. So on the coast and through the Midwest, you can see that it's very dark, and then to the West Coast, which is in the California area, it is also dark, but our central portion is quite yellow. Rural states in general, we found that were very less restrictive from a perspective of control of the COVID. So they were much more open, still travel ongoing, where you had places like California and New York, which were quite locked down overall. So we're seeing kind of a change. The most aggressive states were those like Washington and the northeastern states. Next slide. Now, as of June 12th, you can see that the US is returning quickly to normal, although we are seeing a July coronavirus surge. And this is occurring in many different locations. California is looking at reversal, as well as Florida. So those are on the two coastal states. So we are seeing a change, and what we're looking at is, well, what is the difference overall when we go through kind of the opening and closing, the changes in safety, and it's quite unique and offers a very good perspective. But before I really get into that, I'd like to go to the next slide, which gives you a comparison of what we in the US did. So if you look at the yellow on the top, that is the United States in terms of what we did in comparison to Italy, which is in the red, and Spain, which is in the green, the bottom part on that top chart. So for us, a lockdown was not necessarily as aggressive of what we might have seen in the EU by comparison overall. It's quite interesting because for the US, the perspective is this is very, very stringent, very, very difficult overall. I also wanted to show you a comparison of a few states. Of the most aggressive states, California in red, New York, and Washington State overall, you can see that pretty much there was a lot of similarities. The shape of the curves in both cases are the same, which will basically, you're going to see the same results throughout the states, although you may see it at different levels in terms of an overall comparison. So next slide, please. So one thing that we're finding, so in the US, our ability to really respond and understand essentially from the differing perspective of the states, each state may have a different way of reporting fatalities and serious injuries. So the data is not necessarily all the same. It comes in at different times. So what we often find, rather than reporting at the federal level, we'll have associations, and in this case, the Governor's Highway Safety Association is reporting essentially what they're saying in terms of the safety effects of COVID. What they say is essentially that there's faster driving, and we'll look at that and get it a little bit more into this Washington State perspective of what that really means. California saw a decline of 50% in fatality and serious injuries, and for California, that's pretty amazing. California overall is a very, very large state. It is essentially both urban and rural, in a lot of very high density urban locations. So California has a lot of transit facilities. And if you look in comparison, the US maybe to European Union, the US has less transit operations or public transportation available overall. Minnesota and Massachusetts have doubled compared to last year. So unlike California, we are seeing some states that are seeing significant increases overall in terms of the fatal and serious injuries. Nevada and Rhode Island, Nevada is a location where we have it's a mecca for gambling and those types of things. People come in, pedestrian crashes are increasing overall. And walking and biking increase as transit decreases. So we're seeing very, very significant decrease in transit. So if you think about this from the perspective of the United States, our lower income communities are being vastly affected by the transit drop, the COVID, and are doing more walking and biking comparatively. If you look at our overall rates, essentially, we're nowhere near in comparison. We operate much more on the single unit vehicle in terms of our main mode of travel. Next slide. So this is just to give you an idea. In Washington State, what we chose to do, we had a very difficult time essentially understanding what was going on in terms of the perspective of what COVID was doing to our transit system. So the next few slides I'm going to be discussing are related to that. We set up essentially a website that is analyzing on a day-by-day basis for use by our executives as well as the governor to essentially track the effectiveness of orders. And it might be a little bit faint on this, but you can see in A, B, C, D, and E. Those are essentially when the governor presented executive orders to Washington State, And we were tracking essentially what the trends were after those executive orders were issued. So the executive orders are essentially their ability to make changes to how the public might gather at a specific location, or how travel is to change overall. But here you can see bicycling is up 19% and 49% for pedestrians. Next slide. So traffic, as you can see, is returning. So we saw drops of traffic anywhere between 10 and 22% overall in terms of the major county volumes right now today. But at the peak of the COVID, we had between 50 to 70% essentially drops. So those are quite significant. These are just comparisons of the area within Seattle, which is our major metropolitan area within Washington State. But again, we're tracking on a day-by-day basis to see how things are going. Next slide. So here's the big kicker. Our speeds are increasing. Now, this is no different than what we've seen, but there are some very, very substantial speed increases. Now, a couple of different locations that we're finding them. Where we had high urban congestion, we're seeing significant increases of 15. So what would that be? 20 plus kilometers essentially per mile of speed increase. And those were in our dense areas where we had high congestion. We're also finding in our rural highways, essentially, that operate between our counties, so our location to location, we're seeing speed increases on those facilities as well. But speeds overall, we're seeing between 23 and 43% up during the reopening period. What's this going to lead to? So tie this into the idea of safe systems, and you'll get an idea that this means that there are going to be higher severity type impacts typically that we're going to be seeing in the near future. Next slide. So as we go into this, what we saw is overall crashes and multi-vehicles decreased. Next slide. But on the opposite, what we found is runoff road and single vehicle crashes increased significantly. So these are typically speed-related crashes overall. What does that mean? How do we deal with that issue, and what is it that we need to do moving forward? Next slide. So from Washington's perspective, essentially, next slide, please. So from Washington's perspective, we found that the road safety manual was a very good assistance to us in the way that we think about things. We're hearing a lot more about the safe systems, and safe systems overall, if you haven't involved yourself with it, is something to think about. It talks about the frailty of the body. Speed management is a key issue. The use of safety data was really important to how we were able to assess essentially what was ongoing within the COVID environment and what that was in comparison to the bigger environment overall. Again, monitoring, analysis, and evaluation we've outlined in the road safety manual in chapter 12, but we were able to define the traffic COVID, the crashes that were occurring, where they were occurring in terms of in our clear zones, people hitting fixed objects. Those are issues that are really tied into safe systems design and your ability to address those issues overall. The next slide, please. And in addition to that, one thing that we found that was very valuable as well is the issue of safe driver behavior. Speed management is something that we're really looking at in Washington State. The ability to have variable speed limits is something relatively new, but it is something that we are looking at improving and doing more of as we move forward. I've seen a number of locations that have had added speed sign type indicators for people to look at and to adjust their speeds. We get used to driving a certain way. We get in tune to doing that, and then when something different happens, we don't change our behaviors because of that. There's also important to note here some very good documents that were done last time, I think, by TC 1.1, which was the road safety, or 1.2, which was a road safety committee on road user interaction with the human. Is something to check out. We've used that manual or guidance overall in a number of different locations, and something I think that is very important. With that, I'll go ahead and essentially give it back to you, Rob. I think first Patrick or Christos, and then to Rob.
Yeah, thank you very much, John. Patrick here. It was really a great presentation. Lots of data analysis, which I think is really a great way to approach an issue. And I see there's already a couple of questions for you in the chat channel. A message to all, two messages actually to all participants. We don't really use the raise your hand feature. So if you want to send a message though, please type it in a chat window here on the right side of the menu bar in Zoom. That's really, really welcome. And also please feel free to ask any question you want. You can use the Q&A button or you can use the chat feature. And Christos Xenophontos will handle that near the end of the webinar. Thank you, John, again. And our next panelist is Rob McInerney from iRAP. Rob?
Excellent. Thank you very much, Patrick, and hello to everyone joining us today. I'd like to cover a focus more on the stimulus measures that are happening by governments around the world in terms of the COVID-19 response from the economic perspective, but how we can help as road agencies use that stimulus to save lives. Next slide, please. Some background of myself. I'm the Chief Executive Officer for iRAP, the International Road Assessment Program, and as Patrick mentioned, have played a key role on TCC1 with John and other colleagues as part of the Road Safety Committee as the English-speaking secretary over the last 4 to 5 years. My background is over 25 years of road authority, route research, industry, and international development experience. Next slide, please. What I'd like to talk about today is how the stimulus can really capture the desire to both protect lives and livelihoods in terms of our economies, how that can tie into the global policy targets that have been set by the UN, the World Health Organization, and many national governments, how we build the business case for that investment in safer roads, and particularly with a focus on active road users, and then be able to celebrate that success. Next slide. The iRAP partnerships around the world now extend to more than 100 countries, and we work very closely with the road agencies and the toll road operators and the financiers of road infrastructure projects to work together in partnership to save lives through safer roads. We've now seen assessments on more than 1 million kilometres of roads around the world, and many of the countries represented here tonight have some form of risk mapping or star rating data in your country. So feel free to make contact with me to make sure you can access all of that data that is already available. And importantly, we've helped shape more than $75 billion US of investment that's been made safer around the world. Next slide, please. What I'd like to capture initially is the scale of the global pandemic. COVID-19 is a tragic pandemic that is touching every country on Earth. Road trauma is also a global pandemic that touches with tragedy every country on Earth. COVID-19 has, on average so far this year, around about 55,000 cases every day. Road trauma, there is 100,000 new cases every day. 2,800 lives are lost every day with COVID so far this year. And in road trauma, in a normal year, 3,700 lives are lost every day. So they're both huge problems that deserve a global response, and with an urgency that we've seen with COVID that we would love to see with road trauma. And one of the big differences is with COVID, 80% of people will recover with no treatment. 20% require hospital care, and most of those will recover within 2 to 6 weeks. With road trauma, we've done some estimates globally about the injury burden, so the true cost on the health system that many of our responses to COVID are trying to tackle. We have more than 7,500 brain injuries every day, 1,000 spinal injuries every day, 25,000 limb fractures and rib fractures every day, 9,000 internal injuries, and 900 deglovings where the skin is torn from the body as a cyclist or motorcyclist is coming off of their vehicle. And we've got this data for your country. So that web address there that you'll be able to access, you can see our estimate of what is this burden of injury in your country. Next, please. As John and our other speakers will cover, the general trend is a reduction in vehicle mobility, a reduction in use of public transport, an increase in speeds, and an increase in vulnerable road users. And I've pulled one example from India there, just capturing similar trends to that John has shared and our other speakers will share. And recent data from Delhi suggested more than 1,500,000 speeding fines were issued just in Delhi during the 3-month lockdown, really reinforcing the challenge that John has already covered, that is increased speeds, increased vulnerable road users without the right facilities for them equals an increased proportionate in death and injury. Next slide, please. So that leads me to the opportunity for road authorities all around the world. When I've been listening to each country's response to the COVID crisis, they often talk about it is a trade-off between protecting lives by having lockdown or protecting livelihoods by leaving the economy open. The great news with road safety stimulus is it will both protect lives and protect livelihoods. It will save lives, it will save money, and it will create jobs. And that's because road trauma impacts hospital capacity. Road trauma is preventable. The solutions, as outlined in the PIARC manual and other places, are proven and cost effective. The treatments are quick to plan and build. So many of the road infrastructure investments that are road safety are not big and complex like some of the congestion type treatments. They are very quick to plan and build. And in that case, they can be mobilised quickly as part of government stimulus packages to create jobs countrywide. Next slide, please. And at the global level, every country on earth has the mandate to attack road safety as a true global health issue. The Sustainable Development Goal 3.6 actually asks each country on earth to halve road deaths and serious injuries by 2030. Countries around the world have also agreed global road safety performance targets, which include Target 3, that by 2030, all new roads are essentially 3-star or better for all road users, for pedestrians, for cyclists, for motorcyclists and vehicle occupants. And Target 4 is about this progressive investment on all of our high volume roads, whether it's high volume for pedestrians or cyclists or motorcyclists or vehicle occupants, to get 75% of travel up onto that equivalent of a 3-star or better standard as well. So we have the global mandate for this, and we have the economic need for action in the countries right now. And that's our opportunity for stimulus. Next slide, please. So what we're finding in the countries that have got very active road assessment programs, and again, most of these are hosted by the National Road Authority, maybe the Automobile Club or others are involved, national research bodies, the toll roads in the country are involved. Where they've got good crash data, they're able to use that information to highlight where the hotspots are. So the map on the left is from the iRAP program in New Zealand, and they've mapped where pedestrian and cyclist crashes are happening. And you can see there, to really manage the risk for pedestrians and cyclists, you only need to focus onto a relatively small part of the network, but stimulus packages to improve, whether it's pop-up or permanent facilities for those road user groups, can save lots of lives there, and that data can help target that investment. Likewise, the example on the right is the more major roads, the Highways England network, the trunk roads in the UK, where they've been risk mapping every year for 20 years now, and they've targeted the high risk roads. So most of the red and black sections have already been eliminated, but they still can find out where these high risk roads are and where they can be economically targeted with a stimulus package to make the roadside safe, like John was talking about, for these runoff road crashes, or look after traffic calming in the villages and similar type treatments. All about saving lives, saving money, and creating jobs. Next slide, please. The other option, and certainly many of the countries that are here today, India, Saudi Arabia, Nepal, Portugal, South Africa, Bangladesh, Cote d'Ivoire, Nigeria, Greece, Philippines, there is data like this in your countries, and it is accessible, it's able to be used for this purpose. You can see the example on the left is a more local government network, the local roads, where there are still lots of fundamental shortcomings of the road infrastructure. The high-speed undivided road, no sealed shoulders, no safety barriers, and the star rating of those roads for vehicle occupants can help target investment for local government to create jobs in their local government area. Likewise, in cities, here is an example from the work with Bloomberg and the World Bank and Global Road Safety Facility, with the pedestrian star ratings for 10 cities all around the world, where the pedestrian safety levels can be understood and again targeted for whether it be footpaths, speed management, traffic calming, safe crossing treatments, can all be targeted from this same data. Next slide, please. Importantly, every government needs to understand the economic rationale for any of their investment. And as I mentioned before, the discussion around COVID and lockdown has been to protect lives or protect livelihoods. The key thing with road infrastructure investment is most of the treatments have a very high return on investment. For roadside barriers, this example, $8 of benefit for every dollar invested. Traffic calming, $14 of benefits. Footpaths, 5. Delineation, 12. So all of the iRAP data that is in each of these countries, delivered by the road agency in that country, includes this information about where these high return interventions are. And we've also, at the website address below, Vaccines for Roads, Business Case for Safer Roads, have prepared an estimate of what the return on investment would be at a national level if you were to bring roads up to 3-star or better by 2030 in accordance with the global targets. Nigeria, just here as an example, crashes cost 5.3% of GDP, but investing in speed management and infrastructure upgrades could deliver more than $29 of benefits for every dollar invested. This is a win-win-win outcome for governments, and mobilising it as part of their COVID response provides that opportunity to both save lives, save money, and create jobs in this unprecedented time at the moment. Next slide, please. So what we also encourage for all of the countries who are investing, again, whether it's a pop-up facility or permanent, is to celebrate your success. This example from Shanghai, where Yangpu District has transformed one of their urban roads from 3-star, 2-star level for pedestrians and cyclists, and have now achieved 5-star performance for pedestrians and cyclists. That's been measured and celebrated, but importantly, you can have the politicians, the road engineers, the road authorities there, ribbon cutting these brand new 5-star, life-saving, job-creating roads that will save money in the long run through the savings to the health sector. Next slide, please. Likewise, you can target your COVID stimulus to our most vulnerable, children, and look at bringing the journey to school to a 3 or 4 or 5-star level for children around the world. And what we hope for there, if we can go to the next slide, please, is the opportunity as part of the Star Rating for Schools program that is being delivered by NGO partners all around the world. This example from Vietnam with the Asia Injury Prevention Foundation, but also great examples in Uruguay with Gonzalo Rodriguez, UNICEF and others around the world, where they are, by simple measures like a raised platform crossing, are taking a journey for a child from 2-star to 4 or 5-star. Again, making that journey for our most vulnerable the safest we possibly can. That would be a great legacy of safer roads for children that we could create as part of a COVID stimulus package for 3-star or better roads for children. Next slide, please. And in our urban areas and cities more generally, really what we need to do is focus on this transformation of very car-centred streets and design standards through to very human-centred design, where we start to really focus on creating a living space where our pedestrians and cyclists and the vehicles and motorcyclists and other mobility options can be risen to that 4 and 5-star level. This example that's part of NACTO's work, which many of you will be familiar with, but also as part of their Global Designing Cities initiative, where we're looking at these standard cross-sectional changes from 2 and 3-star to 5-star in this case. And this is achievable. Again, we can use the COVID time with an increased focus on public health as our opportunity to really transform our streets permanently for the better and save lives as we do that. Next slide, please. And it's not just about cities that we can create these outcomes. Just recently in the Thai government, the minister actually referenced the iRAP program as part of seeking budget commitments for 2021 to bring the Thai road network up to 3-star or better. El Salvador's Coastal Highway, the Bruce Highway in Australia, the 2+1 examples from Sweden that are up at 4 and 5-star level. But I did want to highlight the work in Brazil because there is fantastic work happening by the government of Brazil, by Sao Paulo state and other states, where they are bringing their toll roads and reconcessioning some of their existing toll roads with the condition that they bring them up to a 3-star or better standard as part of the reconcession agreement. So private sector investment, delivering life-saving outcomes for the health system and safer roads for all of their customers. So whether it's private sector road operators or public sector road operators, we can really capture the energy of COVID-19 and save lives. Next slide, please. As Patrick mentioned, data is very important. And if we can measure success, often when we're putting in sealed shoulders or rumble strips or wide centre lines, it's not that politically supportive. It's hard to announce. But to ribbon cut and celebrate 4 and 5-star roads as they are financed, and particularly as they contribute to the global targets and the SDGs, can provide this opportunity for a real acceleration in the life-saving deployment of infrastructure that will save lives, save money, and create jobs. Next slide, please. And we can measure that progress over time, so every project can be celebrated. And there are great resources that can help you when you get to the detail of how to design these roads well, whether they are pop-up facilities or permanent. The PIARC manual is an example. Our Vaccines for Roads resource really has a lot of information there to help you to have a discussion with Treasury about why stimulus in infrastructure safety is one of the best investments they can make, because it will reduce the burden on the health system, it will generate jobs in every corner of the country, and it will save lives and leave a legacy of safer roads for the future. Likewise, WHO's 10-step plan for safer road infrastructure and their global road safety performance targets are all there for you to use. Next slide, please. So in closing, really what I see is a compelling argument that you as a road authority can put to your government, and that is that the burden of road trauma on our health system is huge, significant, and long-term. Lives are lost, but also the brain injuries, the quadriplegias, the limb fractures place a burden on individuals, families, business, and communities and our health system that can be avoided. That we have the treatments and solutions as an engineering community to be able to reduce that burden and save money in our health system that needs to focus its resources on health problems. And in the process, whether it's major motorways in France or it's building footpaths in Addis Ababa, is that every one of these treatments can be rolled out in a way in which it creates local jobs, employs people, and both protects lives and protects livelihoods. Thank you very much.
Thank you very much, Rob, for this in-depth presentation of what iRAP does. And I invite everyone to ask questions to Rob using the Q&A button in the middle of the menu bar there. It's really welcome. Or to John Milton, actually, as well, our first panelist. Our third panelist will be Jun Takeuchi from Japan. Jun?
Yes. Oh, can you hear me?
Yes, very well. Thank you.
Yes, thank you. Oh, good afternoon, everyone. So thank you for having the opportunity to share the information in Japan. Next slide, please. Oh, I'm Jun Takeuchi, currently working as a technical advisor of ST3 in PIARC, and originally have worked in Nexco Central as a civil engineer. Nexco Central is one of the expressway companies in Japan, operating and managing about 2,000 kilometers in central Japan. Next slide, please. So today, as a representative of Japan, I will talk about how the road administration in Japan has handled COVID-19 spread through the various policies. So let me explain the current situation of the infection spread in Japan. The figure on the left shows the number of new cases in each prefecture. So as you can see, with the large cities such as Tokyo and Osaka showing the highest number of new cases. And also the graph on the right side shows the number of new cases on daily basis. Currently, the number of deaths is over the 900, and the total number of new cases has been about 20,000 in Japan nationwide. Next slide, please. So against the background of these increasing number of new cases, the Prime Minister declared the state of emergency nationwide in April 16th. And as the situation gradually changed and the number of new cases decreased, the Prime Minister lifted the state of emergency nationwide in May 25th. Next slide, please. So in response, the government has taken the initiative to consider and implement the policies against COVID-19 for road infrastructure. This detailed slide shows the road administration policy for realizing new normal. Japan has been working on various policies to tackle with COVID-19 spread. So this table is a comprehensive list of Japan's past and future policies during the time with COVID-19. Road policy can be broadly divided into two categories: stay-at-home request and use restriction of facilities on the left side, and also the road management and operation implemented by road administration on the right side. Here, I would say that some policy is related to road safety and others are not related to the road safety. And let me show you the policies at the time with Corona. Upper side of this slide, which means a period until some countermeasures such as vaccines are acquired. As stay-at-home request, there have been 4 types of policies achieved, such as closure of restaurants at rest areas in expressway, exemption from holiday discount on expressways, closure of parking lots, and publication of traffic volume. As preparation towards the incoming COVID-19 epidemic, temporary use of a sidewalk, continuous monitoring, and quick publication of traveling history, and also the established toll system of control traffic volume. Such kind of things have already are now conducted or considered. Regarding the road maintenance operation, keeping road management and operating gas stations for flight traffic have already been done. Then the digitalization of maintenance management, promoting bicycle commute, and so on, are now conducted or considered for the preparation towards the coming COVID-19. Now, in addition, for the purpose of reviewing the role of road in the post-corona era, a study of the vision for 2040 scenario of roads are changing has been established, and they have explored the role of road to support new lifestyle. Next slide, please. Here are some examples of past achievement until now. We have called for stay at home with a road information board on the expressways. Also, we stopped the holiday discount on expressway to encourage people not to move to the other prefectures. Next slide, please. Let's see the change of traffic volume publicized, which were used to encourage the stay-at-home request among people by showing the current behaviors of citizens. So how the COVID-19 has an impact on the traffic volume of expressways. This graph shows the ratio of the weekly traffic volume compared to the previous year of among the 3 categories: total number of the cars, passengers cars, and the trucks for each expressway management companies. The solid line shows the all vehicles, and the dotted line shows the passenger cars, and dashed line shows the trucks. So as you can see, in the late April, during the state of emergency, passenger car decreased by about 80% in the Golden Week period compared to the previous year, while the truck traffic decreases only by 20%. Next slide, please. So the same trend has been observed on the national highways. The decrease in passenger car traffic has been 20 to 30% at maximum, and more and more significant than that in traffic compared to the truck traffic, which was 10% maximum. But they were not as large as the one on the expressways. Therefore, here the detailed analysis has not been obtained, but I think that it's important to conduct quantitative analysis on how the reduction in traffic volume due to COVID-19 has affected the number of accidents and other aspects of road safety. This analysis could provide a useful data for examining how road maintenance should be conducted during the pandemic. Next slide, please. Oh, this is just a reference for the toll revenue, so please see later. Next slide, please. So this slide shows the road maintenance operation. What we've done in the past with respect to road maintenance and operation are keeping maintenance works and toll collection, and the support for flight traffic by remaining open gas station and shower service at rest areas. I think that which kind of the things are directly connected to road safety, such as the number of accidents. Next slide, please. So in addition, the road administration have made effort to support restaurants affected by the COVID-19. So we have accepted the temporary use of sidewalk as an urgent measures with no charge if they apply for permission to use sidewalk under conditions such as securing for pedestrians. Next slide, please. So as far as the traffic management is concerned, it is very important to reduce the number of people involved in on-site work with the corona era and create conditions in which people do not contact each other as much as possible in order to prevent COVID-19 spread. For example, introducing the CCTV AI analysis has enabled the expansion of constant observation areas without human staff, and the promotion of machine observations with video dispensed with the traditional manual observation. Next slide, please. For example, introducing as far as the road maintenance is concerned, we are accelerating the promotion of AI and ICT to improve the level of services and also to ensure the road safety while reducing the number of people working on site. In road management, we have aimed to build a maintenance operation system like a slide. Specifically, we have improved the way to collect data in the cycle of inspection, to integrate data in planning, and to automate repair work. Although some technologies have already been introduced from the perspective of improving work efficiency, it is expected that COVID-19 will further promote the introduction of these technologies. Next slide, please. In order to prevent public transportation from becoming crowded, the Japanese government has been working to promote commuting to work and school by bicycle. Tokyo is now actively promoting exclusive bike lanes, with plans to complete the installation of bike lanes in Tokyo area in about 3 years. Although there is a safety improvement of separating cars and bicycles by installing the bike lanes, I think that it's important to consider measures to improve further road safety, such as installing the protective fences on the bike paths. Next slide, please. The use of rest areas is a necessity for logistic operators. Using ICT technology, we can reduce the amount of work that used to be done by guide staff in order to guide vehicles to the parking lot. So it is expected to minimize contact with people at the site. Here we have increased the number of the parking lots, and also with the new technology of ETC and forecast technologies with AI, we have leveled the use of parking lot. Next slide, please. In addition, the new parking reservation system has been introduced, and dedicated parking lot has been secured. The need for a parking guide who helps truck drivers find parking spaces on the site will be reduced. Next slide, please. Okay. So currently, the government has established a road policy vision 2040, changing scenario of the road, which has reviewed the road of road infrastructure that will support the new normal. Here, this vision has set out 5 future images in the middle of the slide. The disappearance of the commuter rush, and also the unmanned movement, people and goods are examples of the future images among the 5 images. So even in the post-corona era, we must keep in mind that the essence of road administration policy is to achieve the happiness of people. Next slide, please. This is just a reference, so please see later. Next slide, please. So finally, I summarized some of the Japanese policies already explained in my presentation that is likely to be relevant to the road safety. So for example, in the past achievement, stay-at-home request and use restriction of road facility, and also the road management of flight, and road maintenance operation, digitalization of the maintenance management or something. Such kind of things are related to the road safety in the future. So of course, the COVID-19 has created a difficult situation for the world, but I believe that we could make good use of this situation to improve road safety under a variety of policy. Next slide, please. Okay, thank you for your time today. I hope that Japan's practice will be useful to member countries considering their road management in the post-corona era. That's all for today. Thank you.
Thank you very much, June, and thank you to Japan for having shared with us the insight about the evolution of traffic and traffic management in the COVID-19 crisis and post-COVID-19 situation. This leads us to panelist number 4, Mariusz Kieć. I hope I got it right, Mariusz, from Poland, who present the road safety situation in Poland now. So the floor is yours, Mariusz.
Thank you very much, Patrick, and hello everyone who joined with us today. Please, next slide. Next slide, please. Patrick, can you hear me?
Can you see it?
Yeah. Now it's okay. Okay, so some delay. Okay, I am a PhD. I finished my PhD in the Faculty of Civil Engineering at Cracow University of Technology, and I am working as an assistant professor. And my specialization is traffic engineering, and mainly I teach road design and road safety. I represent the central eastern part of the Europe. It's a little bit different situation in the COVID because it's a less number of cases in this part of the Europe. Next slide, please. Next slide. Okay, and my presentation will consist of 4 parts. The first one is I want to present shortly the situation of COVID in Poland, and then I want to talk probably again as the previous speakers about the changes in road users and safety, and I want to show some mitigation in some measures to mitigate the occurrence of the COVID-19 in Poland, mainly from my country, from Cracow, from my city. And in the end, I want to add some questions what is needed in the future. Next slide, please. And we start relatively late when you compare with other countries, because the first case of coronavirus in Poland was in the beginning of the March, and the lockdown the closure of school was one week later, and the restriction to travel in the half of March, and this period of lockdown was more than 1 month to the half of April, and from the half of April we start the first stage of the abolition of the restrictions, and each stage was for each 2 weeks. So therefore I want to present data from the beginning of March to the May mainly. Next slide, please. How is the problem with COVID-19? How we can characterize this problem? So the first, taking into account, of course, the road safety, the first problem is the dynamic character of the pandemic. So, of course, if you want to change something, the road infrastructure, we need time, mainly years, not days, weeks, and months. So the next one, what we can control is the traffic behavior, and we can see in this time, in the previous months, that this behavior is a big problem, mainly speeding and changing in the transport modes. And also we can observe increasing the share of the vulnerable road users. We can observe decrease in the share of the public transport, mainly in Poland. And also I think that the main problem is how we can solve the dynamic changes is the policy. And therefore, we should focus on the speed management, policy enforcement, social campaigns, and so on. Next slide, please. In this slide, we can see the changes in the road users' behavior, mainly in the changes in the lower exposure to the risk. As you can see, when we have a traffic volume is lower, also the exposure is lower. So on the left side is one of the picture from the European Transport Safety Council report from the April, and we can see the average reduction for number of fatalities is 36%. When we compare, also we can observe the reduction in the traffic volume, even as it is written in the Spain, 75%, Great Britain even more. On the right side, we can observe the changes. It's similar to the US. Of course, the period is a little bit different, maybe, but it's the shape is similar to the US. And this shape is for the rural roads from the national roads. And we can observe that in March, this reduction was similar to the April, about 40%. In the May, the reduction is smaller. It's less or more 20%. When we compare this data with the urban roads from Cracow, work days and weekend days, we can observe this is a similar value for both rural and urban roads. The share of heavy vehicles, the number of heavy vehicles was lower, about 20%, but the share of the heavy vehicles was higher, about 6%. Next slide, please. When we look at the changes of the road users to reduce the traffic volume, it's typical that if the density of traffic is lower, we have a space for speeding, and speeding increase, but of course it's the level is very high. In Poland, it was about 33% more overspeeding in the spot speed monitoring systems, and for the section speed monitoring, it was almost 50%. And also was observed the higher share of the speeding with over than even 50 kilometers per hour. It was almost 30%. Next slide, please. And in this slide, we can observe both how it's changing the traffic volume and speed. The traffic volume is by the contours, and we can observe two pictures. Above is a before, it's the end of the February, and below is the end of the March from the same days. And we can observe also how is the difference in the speed. So the speed is the higher, and the green one color is the speed lower than 50 kilometers per hour. The next one is the next 10 kilometers, and the yellow one is more than 90 kilometers per hour. We can observe that the share of the drivers who drives with speed greater than 90 kilometers per hour is great. We have a more drivers with this speed on the situation after. And the next slide, please. This is the same point, the same street for both directions. This is the opposite direction, and for this, in this situation, for the situation after, below picture, we can see that is the yellow space is bigger than before. Next slide, please. Also, we can observe the changes of road users in the cities. This is from the Cracow. For Cracow is about 700,000 inhabitants. During the lockdown, the decrease it was observed the decrease in the number of public transport passengers, of course, and pedestrian traffic was very low, and the people start to use the bicycles. On the right side, you can see the picture. In this picture, you can see that during the time of the lockdown, so it's from the half of March to the half of April, less or more, you can see, observe the changes in the bike traffic is very high, even 300%. Of course, when we look, when we want to compare bike traffic, we should take into account also the weather conditions, but even 300%, so it means that it was big changes in the traffic. After the lockdown, we observed the increase in the share of vulnerable road users. Also, the number of passengers is greater because it was limited to 50% of seats inside the public transport. So the number of passengers was greater, and also it was observed the increase of passenger cars in the city center. So people are afraid about healthy and prefer to use the private transport. Of course, it is not the impact of the lockdown, but many narrow sidewalks to keep social distance is a big problem with our city. Next slide, please. When we compare the road safety, so as I told, average drop in the road fatalities in the Europe was 36%, but in Poland the same time was 25 in the fatalities, but in the number of crashes it was 39%. And also at the same time, from the period from the March to May, it was about the 33% reduction in the traffic. Also, we observed the increase in the severity of accidents, about 20%. Next slide, please. And in the next two pictures, we can observe the number of crashes, how it's changing from the beginning of this year, 2020, to the half of the year. With the horizontal lines, black and red, we can see the average value for the period March and May this year, and the reduction, the value of 74.2 and 45.9 is the average number per day of the crashes, and we can observe also the reduction in the fatalities, about 25% in this period. But when we look on the right side of the slides, we can see the number of crashes. This is a cumulative value, and we can observe that to the beginning of the coronavirus era, the lines are similar for both years. Next slide, please. In the next slide, we can observe severity of crashes, how it's changed the severity during the coronavirus impact. And we can observe the red line is again for 2020 years. We can observe when start the coronavirus about 11 March. We can observe that it's an increase, and the average value is higher, and it's lower with each month. So with March, April, and May. On the right side, we can observe the cumulative ratio between two years, 2020 and 2019. And what is interesting, we can observe that in the end of the March, the number, the ratio for the fatal was bigger than for the crash and injury, and also for the severity. We can observe that severity is even higher than 1. So it means that the severity is higher. Of course, we think that it's in relation to the speed. Next slide, please. How to mitigate so this impact? So we try to introduce some measures to mitigate the occurrence of COVID, and the idea was to introduce the new speed limits, but it was just initiative of experts, also from our university, to reduce speed on Polish roads temporarily by 10 kilometers per hour for all roads and 20 kilometers per hour for motorway, because on motorway now in Poland the speed limit is 140 kilometers per hour. Also, the next measure was activities were speeding enforcement. So in the results we have a much more fees, and also the next idea was to use different traffic management measures to give more space for vulnerable road users and to provide dedicated lanes and so on. Next slide, please. So in Cracow, we start to develop bike network, and the green one is existing, and the red and the orange are supplemented, which was introduced during the March and April. So the idea was to supplement bicycle roads and also to give more space for pedestrian, for also to provide more extra lanes for bikes. Next slide, please. And in the end, just idea, one of the bridge in Cracow, and before is a bow picture. So it was a road with 2 lanes for each directions, and now it was reduced for bikes in order to give a possibility to keep a safe distance between the vulnerable road users. It was reconstructed, and many of roads in Cracow was reconstructed, taking into account just the traffic management measures without any infrastructure. Next slide, please. What is needed in the end? Just some ideas to conclude my presentation. So we should notice that the activities during the COVID-19 all activities have an expert character. We don't have enough data. We are still collecting data. It's a problem with the quality of this data. So therefore it's important to exchange of observation between the countries, even as we can compare with the Europe. As I show on one of the graph, we don't have all of data from each country, so we should exchange that. It should be the faster in order to adapt activities more quickly based on the other experience. We should provide access to the reliable data. So this is a problem because we have a lot of different ITS, intelligent transport systems, but still we have a problem with the data. Data is limited, and it's time consuming to use this data. And also, we should reliable assessment of the COVID impact on road safety in order to develop policy for the future. We should to prepare the programs and measures it is necessary. So it is difficult because this period of the pandemic is short, relatively short. When we compare with the data, with the time we need to collect the crash data, it was years, so we should change something. So next slide, please. So therefore, we should develop some road safety assessment methods based on the short-term periods and different phases. As we can see here, so the lockdown period was just 1 month, and also we have a different stages and from to finish the lockdown for 2 weeks each. So it's difficult to assess it. So therefore, we should adapt some methods, or we should maybe start to focus on some new methods to assess the situation. And probably we should use the surrogate safety measures mainly and big data. We should try to apply better big data to provide a proactive approach to road safety. We should work more on the proactive approach than reactive approach, which is based on the history of crash data. Road safety, it's important because not road safety, but travel behavior is important because then it's changing in the risk exposure, this non-linear impact. So it's difficult to assess when you have some changing in the selection of the transport modes from the public transport to the bikes. It's difficult to assess how it will be the impact. So we will see in the future when we will assess the effect of the COVID-19 on our life. And also what is important is that increase some role of the random factors. And I think the most important one is think that stronger influence is a human factor. We should take into account now that human factor, as is written in the bracket, for example, additional stress due to the pandemic, we should try to assess, or if we are able, of course. I think that the future is for the autonomous vehicles, so we will reduce the human factor. So it's just some idea. So next slide, please. And I would like to thank you for attention. Thank you very much.
Thank you very much, Mariusz. It was really in-depth presentation with data and ideas about what can be done to address road safety issues. I think it leads to lots of questions, and I invite everyone to ask questions using the Q&A button in the center of the menu bar. Please note as well that we don't use the raise your hand feature, so you may raise your hand, but we don't use that. So please use the Q&A button instead. Which leads us to our fifth and last panelist, Jaime Campos Canessa from Chile. I'm really glad you could make yourself available. You've already spoken in a Spanish language webinar, and I'm sure this will be as interesting. Thank you very much, Jaime.
Can you hear me?
Yes, now we can. Thank you.
Good morning, everyone. It's 8:20 a.m. in Chile. And as you said, Patrick, I'm Jaime Campos Canessa. One thing to say before to start is that every picture showed in this presentation belongs to Chilean roads from the Atacama Desert to some central and southern zones. Next, please. For 11 years, I worked in the Ministry of Public Works of Chile. For more than a year, I'm head of the Department of Road Safety. Here is my brief, where you can see that road safety audits is the area that I'm interested in, and I hope to implement them in the short term in Chile. Next slide, please, Patrick. This presentation will show some effects during and after the pandemic in Chile, focused on road safety matters. It will contain data on roads in Chile, context of road safety, evolution during COVID-19, current operation of roads, current operation of the Ministry of Public Works, and some conclusions. Next, please. In terms of road network, until 2019, Chile has 85,000 kilometers, where 24% is paved. Within that 24%, more than 3,000 kilometers are private roads or concession roads, which means that they require direct payment or through a free flow system. Also, in recent times, there has been a strong work on basic solutions or basic roads, which has allowed the percentage of unpaved kilometers to be reduced. Next, please. Within the context of road safety in Chile, the latest report of the World Health Organization on the Global Status Report on Road Safety in 2018 established that the country has more than 2,000 deaths from traffic accidents instead of the 1,700 approximately that is declared in the country. Because in Chile, we don't consider yet the 30-day follow-up of accident victims. Yeah. The distribution of fatality by type of user is as shown in the slide, where 36% of fatality are pedestrians, the vulnerable user with worse road safety conditions. Regarding the number of accidents and deaths, the proportions also differ, where even though only 16% of crashes are in interurban roads, these contribute the 62% of fatalities, largely due to speed involved. According to data from Carabineros de Chile, that is the Chilean National Police, the highest mortality type of accidents are collisions and run-over crashes. Here we have to consider that at 30 kilometers per hour, there is a 90% probability of survival in a run-over crash, and more than 70 kilometers per hour, the probability of survival is null. Next, please. Regarding to COVID-19 in Chile, the virus is not fully controlled, added to the social outbreak on October 18, 2019, not controlled either. This slide shows the basic data on the pandemic by the government. Currently, every day, there are around 3,000 cases of contagion and 200 deaths. Apparently, slightly better week by week. Next, please. In terms of mobility in urban areas, some data provided by the National Traffic Safety Commission show a pronounced drop month by month due to quarantines implemented. In May and June, for example, we can talk about a 50% reduction in vehicle flow. Unfortunately, these conditions have encouraged motorized users to increase the average speed, both in urban areas, major cities in Chile such as Santiago, Valparaíso, Rancagua, and Concepción, and on rural roads. Next, please. Regarding accident trends with fatal victims on rural roads, despite the fact that mobility has increased due to COVID-19 measures, the number of deaths in the first semester has remained at similar values for the last 3 years. I don't want to say that human factor is the main problem in Chile, but the combination of free flow conditions and lack of enforcement could explain this. It should be noted that this year the largest number of crashes are collisions, with 36%, described as an impact on 2 moving objects. And then we have run over and run off road crashes with 23% each. Next slide, please. In terms of the evolution of transport system in this emergency context, a decrease in environmental and acoustic pollution has been observed. I think that is maybe the only positive effects of the pandemic. Paid public transport such as metro, the subway in Santiago, bus, metro train, etc., has decreased markedly, where the use of masks is now an obligation. There is also an increase in freight transport of food and basic supplies to provide supermarkets, warehouse, fairs, etc., in order to maintain procurement chain. Finally, new ways of transport have increased, which avoid exposure, obviously, in the following order: motorcycles and private vehicle for long distances, more than 10 kilometers, bicycle for intermediate distances, between 3 and 10 kilometers, and walking for short distances, less than 3 kilometers. The image on the right, for example, shows a national article presenting bicycle as an essential item during the pandemic, proposing to keep repair shops open considering the increasing use. Next, please. Thank you, Patrick. About the current operation of roads, next, please. Something like this was expected on roads of the metropolitan region, where many cities have been declared lockdown, but next, please, Patrick. Different situations are happening now. First, the enforcement of Chilean police is low nowadays, which has involved excessive speed and traffic violations. For example, overtaking in prohibited areas, going against traffic, passing a red light, passing a stop sign, etc. Also, there have been 3 long weekends in these last 3 months, and even though the normal flow has dropped, severe congestion has been seen. Lastly, the healthcare facilities are almost collapsed, so there is a low availability of emergency response in the event of traffic accident. That is a very huge problem. Next, please, Patrick. Well, here you can see some news, screenshots of long holidays with the clogging already described. Next, please. Thank you. This is due in part to the inclusion of so-called sanitary blockades and health customs. The blockades work to maintain the quarantine condition in a certain area, and the health customs correspond to areas where temperature and sanitary passport are verified. It should be kept in mind that the reason for moving have been gradually reduced in order to decrease the number of infections. Next, please. Thank you. On the other hand, the operation of the Road Directorate or Highway Administration, I don't know how to say that, where I work, has been adapted as follows. Next, please. Things that are here to stay is the first one, telework with some on-site shifts, implementation of digital signature, use of digital files that exceed the maximum capacity of an email to avoid the use of paper, organization of weekly tasks for permanent monitoring, virtual meetings to organize the work, and use of webinars to work with, for example, officials from our 16 regions, and even international presentation by road safety experts. For example, people from Spain, from Mexico, from Uruguay, etc. Next, please. Sorry, I need water. How to save lives and revive the economy. Here I have 3 main ideas. First one, it's necessary to implement the Automated Violation Treatment Center, CATI in Spanish initials, which have not been approved by the Senate chamber yet. Second one, increase the quantity and quality of facility for pedestrians and cyclists in cities and some rural zones. And finally, telework has enabled us to maintain our highway administration usual tasks and allow us to have a portfolio of projects prepared for when the works can be restarted. Next, please, Patrick. Conclusions, modes of transportation are experiencing changes, both bicycle, even scooter, and motorcycles will no longer be a recreational transport and most likely they will be a forced modal choice to use. Therefore, the use of bicycle path is an important matter to develop. Regarding the increasing use of motorcycles and considering that is the main vehicle to deliver food or supermarkets order nowadays, There may be accidents similar to other countries in Latin America. So here we have another issue to consider and develop, hopefully in short term. To reduce accident or crashes in terms of severity and number of victims, a graded automated enforcement of the speed, for example, the Spanish experience, is needed now in Chile. Massive virtual international events are making possible to take advantage of the use of technologies, sharing information and best practices from everywhere. So they should be a permanent training for Chilean professionals. That is good. Regarding freight transportation, it's expected to implement rest areas located on roads throughout the country. Exclusive lanes will be needed for this usage in order to guarantee the movement of goods with or without sanitary blockades and health customs. Finally, from the point of view of road safety, Chile's economic recovery could be seen as an opportunity for significant improvement on our roads or highways by implementing infrastructure focused on providing services for vulnerable users. We are going to change our way to move. So we need to give a safer space and safer speeds too for pedestrians and cyclists. This is the challenge for the next few years. Thank you very much, and that's it. Thank you, Patrick, Miguel, and Jose Miguel for this opportunity.
Thank you, Jaime. Thank you very much. I mean, it was a pretty sharp and to the point presentation. Well, this brings us to the end of the section with the panel presentations. I would like in particular to thank June, Mariusz, and Jaime, who are not native English speakers, neither am I, as you have noticed, and they are making a great effort to communicate with the whole world. This leads us to the Q&A section, the questions and answers, and this is moderated by Christos from Rhode Island DOT, who is the chair of one of our PIARC committee. Christos?
Patrick, thank you very much once again, and thank you to all of our panelists for giving us the time today. Just a couple of housekeeping. We might be going a little bit late today with the Q&As that we have. A lot of great presentations and of course a lot of good questions. But because of that, we will be doing that. Also, we've noticed that a lot of the questions were really directed to Rob, and they were very specific about iRAP. If I did not have an opportunity to provide you with Rob's email address, we will, and if we don't get to those questions, we will provide them to Rob, and I'm sure he will be more than happy to respond to those questions directly. Similarly, some of the questions to June, we will provide the questions to him. And if we do not have the opportunity to respond to them today, he will respond to you directly via email. So let's start with a question to our panelists, please. And having to do with whether any countries or any road operators have used public service messages during this COVID-19 period in order to help with the increase in accidents that they have seen. John?
Yes, we have seen some, and recently, I know in Washington State, we've had a number of different presentations on speed and information coming out from the National Highway Traffic Safety Association. So the answer to that question is yes, although I think we could be doing a little bit more of that to get the information out, what's happening specific to COVID, and potentially compare it to some other issues that we're seeing right now in terms of road safety.
Thank you, John. Rob, have you seen any good practices relative to use of public service messages during this time to enhance road safety?
Yeah, thank you, Christos. Definitely, and most of them have been focused around speed management and particularly about looking after and looking out for vulnerable road users. So there are some resources I'm aware of that are being coordinated by perhaps the International Transport Forum, but also the FIA Foundation and some other organisations like that. What I can do is find out the links for some of that information, and that way you can share that with all of the participants today.
Thank you, Rob. Mariusz?
Yes.
Have you seen any use? Have you used any public messages in Poland relative to road safety?
No, of course, yes, we have some, but it is limited, the public messages. And of course, now we try to develop and the bike and for vulnerable road user space, and it is not direct, it's indirect in introduction of the message about the road safety to in this period, of course, COVID-19.
Thank you, Mariusz. And Jaime, may I ask the same question relative to Chile, and if you're aware in other South American countries on the use of public messaging?
Okay, I don't know really, but I think that the speed messages are the main objective. The operating speed now in cities and roads is high, and the lack of enforcement, like I said in my presentation, is a very huge problem now. So that's a big measure. I don't know what more to say.
All right, thank you. Next question, go to John Milton. And John, does the increased speed during the COVID-19 lockdown mean increased average speeds, increased excessive speeds, incidents, or both? And as a follow-up to that is, do you know why has any study, are you aware of any studies that have been done? Why would people be speeding during the crisis? Is it because the lack of traffic or some other psychological reason? And how will you guide drivers to get back to normal behavior during this time?
All right, the first part, yes, we've seen both an increase in average speeds as well as speeding. So the locations that we've seen more of the speeding occurring has been on the higher facility types, our interstate systems, and also our rural major arterials. We see a lot of speeding right now. Average speed, the biggest changes we've seen is where there's been reduced congestion, so people are more able to free flow. The other aspect that we're seeing is, our ability to change the behavior in terms of speeding. There's been some enforcement, although we've had other challenges in the US that we've been dealing with. The use of variable message signs has been something that we've been trying to use to help people change their behaviors as appropriate. And I think there was one other question that you had, Christos.
Let me go back to the question again.
In the consciousness, again,
how do we get drivers to get back to their normal behavior?
I think it's to continue to repeat the message. I think some of this will return to the normal behavior. Part of this we've been attributing as well, and that was the other part of the question. We've been attributing as well as to people being in quarantine, they're more likely to take high-risk behaviors. Hopefully over time, as we modify the speeds and take a look at what's going on specifically, we'll be able to address it. But I think it's going to be a relatively midterm type of activity for us. It's going to take a while to get the speeds back down. Because we're also seeing, as the congestion is starting to increase, we're still seeing some challenges.
Thank you, John. Our next question will go to Rob. And Rob, this is a little bit more general in nature relative to safety. Do you believe that with autonomous cars will help reach the 50Y30 target easier?
It will definitely help us reach it easier. Basically, in a safe system context, we need to have safe vehicles, safe road users, and safe roads. And the autonomous vehicle will help us manage some of the human behaviour issues that can be part of the problem on our roads. So they are definitely part of the solution. The challenge we've seen is some people feel like the solution will be able to accelerate through all of the fleet and solve a lot more problems than perhaps is realistic. We will still see run-off road risk on high-speed roads, and the ability of autonomous vehicles to fully deal with all of the issues coming up there may not be able to see that level of increase. So I think the key message is they are part of the solution. They will be a key part of a safe system going forwards. We do still need to invest in infrastructure, safety, speed management, road user behaviour, because the fleet penetration rates will be relatively slow. But also, as you'd know, like vulnerable road users, pedestrians, cyclists, motorcyclists, they're all still out there on the network. And I'm not aware of an autonomous motorcycle yet, or bicycle, but obviously while we have this mix of road users, including trucks and different mass vehicles, that we will need to do more than just autonomous vehicles to halve road deaths by 2030, but it's definitely part of the solution.
I am definitely fearful of autonomous pedestrians in the roads these days.
Indeed.
Our next question goes to June. June, COVID-19 infection spread might trigger the introduction of new ICTs and automated machines for maintenance management to reduce the workforce on site. Do you think this change would have an effect on improving road safety as well?
Okay, thank you for your question, Kratos. So in this situation, now is a COVID-19 spread. So the priority would be to reduce the number of worker contact on site. So this would lead to the greater work efficiency. And I believe that some of the new methods which are directly related to on-site works would also create a benefit for the improving safety on the road. So for example, during the road maintenance work, people have to work on the road to clean up the large garbage or repair the surface with the traffic regulation. But if these works could be mechanized and automated so that people don't have to get on the expressway, I think that naturally the safety level of workers and the road users would be improved. Thank you.
Thank you, June. Mariusz, the next question is for you. Was there a notable change in road user behavior with the reduction of speeds? And what was the response of society in general when the lowering of speeds was affecting the networks?
Okay, but thank you for this question. We observe the increase in speed. So the reduction in speed we observe just in the cities, in the city center, but of course it is probably in relation to the congestion, because the number of private cars is bigger. So therefore is a reduction in speed in the city centers, but outside on the rural roads, the speed is higher. So of course it's the impact on the severity. So we can observe the impact on the severity, and also as I showed on my presentation, the police enforcement, the police observe also the higher speed, but it is mainly for roads, for spot monitoring speed sites and for the sections. So I think that the behavior is in a relation in the density of traffic. And I think when we come back to the normal situation, also the speed should be similar. I think that autonomous vehicles can have big impact on this behavior in the future. So in the similar situations. So thank you.
Thank you, Mariusz. Jaime, the next question it's for you, and it's relating to road safety in the desert. And how do you struggle with that problem, and how do you find solutions, particularly during the COVID-19 time?
Hello? Can you hear me?
Yes.
Okay. In the Atacama's desert, we're trying to establish the concept of forgiving roads. The problem is drivers always get sleep in some straight lanes. The rumble strip is I think that is a device that we want to develop in the future, and I think that is the main problem. The drivers get sleep. I don't know what more to say. The long distances between cities is also a problem, where the emergency or sanitary public or hospital are very far from the accident, and that is a main problem here in the north of Chile.
Thank you, Jaime. There were quite a few questions to the individuals on bicycling, and so what I am going to do, I have actually groomed them together, and I'll ask these questions to all of our panelists, and you know, starting with John, Rob, Mariusz, and Jaime. And many countries, cities seem to encourage cycling in the wake of COVID-19. What is your analysis from a road perspective, and how can we promote safe use of bicycle and reserve space for the same within the road infrastructure? John, would you like to take this one first, please?
Yeah, that's a great question. You know, one of the things that we're doing in Washington, I've seen elsewhere, is that we're using some of the road excess capacity now exists on the road surface and modifying that for use by pedestrian and bicyclists. To me, that's a great opportunity that, you know, it's not dissimilar to what we're seeing with road diets, but from our perspective, that is something that we're trying to encourage. I think in what we're calling the new normal, there's going to be a lot of that as an opportunity. We're finding that many of us won't be going back to work like we were in the past, so there's going to be more need for other modes of transportation. So hopefully we see that occur.
Thank you, John. Rob?
Yeah, thanks, Christos. Look, I think it's a very big challenge because in general, our road networks have not been well designed for active road users and in particular bicyclists. From our data around the world that's available on vaccinesforroads.org, we've found that 86% of travel for cyclists is currently at 1 or 2 star level. So if we see this rapid increase in cycling numbers without the sort of pop-up facilities or reallocation of lane space that John has just mentioned, then I'm sure we will see an increase in injuries. You may not see it in the official data because in many countries, even the Netherlands, there is very large underreporting rates for cycling crashes. I myself had a cycling crash, a single vehicle bike crash during lockdown, and it's not reported. And I think that is a very big challenge. So certainly the key solutions are speed management, dedicated lane space for the cyclists, and managing the intersections very well. You also mentioned how do we make sure that there is even more some of the behavioural awareness of people as they take on more cycling, which again is a great active transport It's good for our health. It's good for livable cities. We should be encouraging it. And it's where from New Zealand all the way through to New York, we are seeing pop-up facilities happening for cyclists, and how we can perhaps help with guidelines for how they can be turned into permanent facilities that really lock in both the mode shift benefits and the safety benefits of that mode shift into the future.
Thank you, Rob. Mariusz?
Okay, so I think that we, of course, I can talk from our perspective too, from Cracow, and the people want to use the bikes, wants to use the different individual transport mode. And I think that now to encourage the users to use we don't need it. We need more, mainly we need more facilities for the bikers, for other users, and we should supplement bicycle roads. We should change, we start to do it, to change and to give more space for the pedestrians, more space for the bikers. I think that for the future is also the question about the others transport modes, individual, like the scooters, for example. It's developed rapidly in Europe, not only in Europe, in the world, I suppose, and other transport modes. And I think that we should provide more space for this type of the users, not only for the pedestrians. When we provide extra lanes for e-bikes, for the scooters, for bikes, then we'll have also more space for the pedestrians. So I think this is a good direction. And in Poland, we can observe during this pandemic time, this period, that more people start to use the bikes, start to walk, and reduce the using. It's not good also to public transport. So we will see how it will work in the future. Thank you.
Thank you, Mariusz. Jaime?
Okay, the use of bikes is now a good measure to avoid contagion and other benefits. But I think we will have to invest a lot on bicycle path. We're working now on a new standard in Chile with where the path is going to be wider. There includes safe zone between the road and the bicycle path. And I think we have to take advantage of that, where many people, including me, are using bikes, and we want to do this this kind of transport from here to now in the future. Thank you.
Thank you, Jaime. And John, as a follow-up on this, did the Washington State DOT make any network changes to support active transport and bicycle walking as a result of the uptick that you are seeing in cycle and walking? And if so, what was the most effective change that you made? And do you expect it to be sustained beyond the pandemic?
Yeah, good question, Christos. Yes, we have made some network changes in a number of different locations where we feel that we can maintain kind of the safety for both the pedestrian and those using the road system in vehicles. We are looking and working with each of the individual cities as well as localities that might be responsible for the road other than Washington State, where we're making some of these changes. My hope is that we can maintain at least some level of this modification into the future. And if we can do that, I think it will be quite substantial. Again, we are looking at the safe system as an approach, and we are trying to increase its use as well as trying to increase active transportation. So we have some additional build out, I think, of the system that we need to do. And we've seen both the federal government as well as our state government looking more towards active transportation as a great mode of travel for Washingtonians.
Thank you, John. Also following up with Mariusz, some cyclists are inexperienced or seem to behave as if they own the roads. How do you protect pedestrians from that behavior?
Oh, it's a big problem because the culture of using of bikes is different, and because now we have a period of rapidly increase in the share of the bike users, in the share of bike users increase in the traffic. So therefore, it's a big problem, and also it's a problem because the same as it was mentioned before, we have a problem with the width of the sidewalks. And very often sidewalks are used together with the pedestrians and cyclists. So now it is not solved yet. So I think it is for the future. And it's a big problem also with the culture between the drivers and bikers. So we should, in my opinion, we should provide better infrastructure. It is difficult, of course, because of the limitations of the space mainly, but we will see in the future. Now it's a big problem. I don't know how to solve this.
Thank you, Mariusz. And I see that you responded that you would like to answer live on one of the questions that we have on elaborating how the reduction of speed limit contributed to the mitigation of the occurrence of COVID-19. Would you please like to respond to that one now?
Yeah, because it was just idea in the beginning of the lockdown. There's some group of the experts to suggest to send to the letter to the Ministry of Health Ministry and to suggest to reduce the speed limit. But in the end, it was not introduced. So I am not able to respond for this question. Of course, idea was like it's from the literature review that we will have a lower speed limit, severity will be lower, so it will be easier to find some place in the hospital for the people with the COVID, not with the as the victims of the accidents. So it was the idea, but it was not introduced, so I am not able to respond. So.
Thank you, Mariusz. Rob, this really, when looking at establishing priorities and during times like COVID-19, it's even more important. How do you take the cost of remedy measures into account when looking to establish safety priorities?
Yeah, great question. I think in terms of COVID-19 response, what we've seen is the use of pop-up facilities. And they provide us a great example of how a very low-cost application of something that is a proven intervention with a high return on investment, even with normal engineering standards, can actually be accelerated very quickly, both from a planning perspective, but also a deployment onto the roads. We see that with some of the active urbanism, where they're using chalk to mark out traffic calming and transformation of urban road precincts. We're seeing that with the pop-up bike facilities in Auckland and other countries around the world where they have, in Paris and others, where you're seeing this reallocation of road space using very low-cost interventions. So I think that's a great starting point, that when the cost is low, the return on investment is very, very high. I think we then have, as John mentioned, an opportunity to perhaps do some of the more robust analysis about turning that pop-up facility into something permanent. And that's maybe where some more optimization of investment is needed, working out how we can maximize lives saved per dollar spent, and whether that's using the investment plans that we've got in our programs around the world, or it's sort of the established road safety audit type practices and others. Certainly, I think we will have some data to be able to drive that. The PIARC manual itself has great information on the expected reduction in casualties from a lot of these treatments. So we can sort of do the pop-up stuff quick, low cost, guaranteed to be good value for government. Then we can do that more rigorous analysis for the permanent facilities.
Thank you, Rob. Next question will go to all the panelists, and we'll start with Jaime on this one. How do we elevate the consciousness of drivers regarding road safety when their usual way of being is very undisciplined, particularly during this time when we see increased speeds due to less traffic and open roads. Jaime?
Very tough question. We need to Carabineros de Chile or the national police is now in other jobs to do nowadays. So it's very difficult to make a real enforcement on cities or on roads or highways. I think the problem is the human factor in Chile is very, very high. So I don't know what to say about that, how to control that. Maybe the speed control could be a solution, but I think we need at least 1-2 years to make all the investment and all the devices that we need for do that.
Thank you, Jaime. John?
Yeah, I actually think it's twofold, if you allow me to go in just a little bit different direction here. I think one thing that we have to do is raise the consciousness of the designers and operators of the facilities in the US, and do that through design guidance. When we update our national guidance, we should make sure that there's active transportation and issues that are important to everybody in those documents. I think as well, just trying to work with the issue of culture of the driver and of the road safety, I think is very important, and how you get that out is going to differ by country most definitely, and even in the US by state. But it's something that we need to continue to focus on, address it the way that we do through enforcement and education, and look for innovation to help drive this, particularly as we move more and more towards the autonomous vehicle environment. Some of this will go away, but I think people will have to understand how to drive differently, as well as road users operate differently when vehicles are making a lot of the decisions for the driver. So those are my answers.
Thank you, John. Rob?
Thanks, Christos. I think a couple of perspectives on this one is, in general, road users believe that they are safe as individuals, and this problem, our community understanding of infrastructure safety, for example, is actually very poor. So certainly what we encourage is for countries that have collected the star rating data, that they actually publish that in the public domain for a few reasons. One is it can help the community understand that some roads are safer than others. For various reasons, might be because of alignment and geography, it might be because of budgets available, or just historical opening up roads for access and coming back later and implementing safety. But the key thing is that some roads are safer than others. And if we publish that data, then the public can become aware of that and also start to understand how their risk changes along a road. We've been doing some work with major fleet managers to essentially build in an active star rating into what they are doing. So for example, if you are driving at 50 kilometers an hour on a relatively unsafe road, you might still be operating at a 3-star level, for example. But if you were to speed up to 70 or 80 kilometers an hour on that same road, suddenly it's 1 star. And if you like, rather than a speedometer that's going up, you're seeing a star rating that actually comes down. In part, that's concept at this stage, but we are building that into training courses for fleet operators. And ultimately, I see this coming forward through telematics. The sort of data that many of our other speakers provided tonight, speed data on a large scale, has come from telematics devices, our mobile phones. And I'm certainly aware of a range of apps that can tell you whether you're a good driver that day or not. And that's in relation to speed, braking, the way you're taking corners, various other things related to your acceleration rates. And I think if we can start to bring that more into the public consciousness, then we will bring in both an awareness of some roads are safer than others, that the way they drive impacts their likelihood of getting home safely or helping someone else get home safely, and bring in some accountability for how people operate and use our road networks as part of a safe system.
Thank you, Rob. In the interest of time, and I know we're running a little bit over, I will just have one last question to our panelists, and we'll go with Jaime, Mariusz, Rob, and then John, as John is also the TC chair for Road Safety Committee for PIARC. And then I will turn it over to Patrick at the end after that. So our last question is actually, it's a little bit, more general in, in nature on safety. And do you have new ideas out of the box how to achieve Vision Zero? What can we do in terms of research, whether it's using new technology, using autonomous vehicles, etc., that can help us achieve Vision Zero, especially as we are dealing with, we are in the middle of a pandemic right now. We start with Jaime.
Thank you. I think Chile needs to improve something that are very usual in other countries, but in my country, we still, for example, we don't have the road safety as a issue in road safety project of the what costs road safety in terms of the cost of a life. For example, we don't know how to measure that, so we don't know how much we have to invest in road safety. But I think that in the future we need to not only consider the motorized users only, we need to consider cyclists, we need to consider pedestrian. So we need to start on the basis of road safety in Chile to start to make a change for the future. Thank you.
Thank you. Mariusz?
Oh, okay. So I think this is a still open question, Vision Zero, because I think that different countries are on different level. Now in Poland, we still try to develop infrastructure, and our infrastructure still needs some work. And of course, it depends on the road authorities, on the level, national, regions, and local. And I think that it's also, we should, of course, a part of the infrastructure, which should, of course, we should improve it. In my opinion, we should start to use the proactive approach to assessment of our road network, not only reactive. We need more, better data in order to have some tools to assess this impact. And I think for the future, the main problem will be with the variable road users, pedestrians, bikers. And I think that we need some new technology, maybe in the car, autonomous vehicles, to go to the Vision Zero, because I think that now the human factor is the biggest one, with impact on the severity and number of crashes, maybe less crashes, but for the severity, I think yes. And therefore, we should focus mainly on some other new devices to help people to change the behavior. Thank you.
Thank you, Mariusz. Rob?
Yeah, thanks, Christos. I mean, Vision Zero is about saying that no level of death or injury should be acceptable on our roads. And from our perspective, the very simplistic view of what safe system is, for me, is 5-star vehicles on 5-star roads driven by 5-star road users. And that means all road user groups, so the pedestrians, cyclists, and others. If we can get to that point where we have 5-star roads, 5-star vehicles, 5-star users, and a lot of technology will play a key role in that, whether it's the autonomous technologies, artificial intelligence and other aspects, then I think we are on the right direction to zero. The other one approach that one of the countries we're working with has come up with is that when they're looking at a road design, they start at a 5-star for all road users. So they set the infrastructure features and speeds at 5-star, therefore sort of getting as close to zero as they can. And then they try and make the design teams justify any departures from that. It's a really interesting approach. It's shifting from designing for standards to designing for outcomes. And I think if we do that, then that will help us do the step change we need to achieve Vision Zero.
Thank you, Rob. John?
You know, I think Rob hits on a lot of the items that I would do the same. You know, we need to understand our system better and be able to evaluate it one way or the other. 5-star, 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 I like that idea. We have to come up with an appropriate means of investment. In particular, many locations and nations favor mobility at the cost of safety in many cases. We have to take a look at that. For us to achieve this Vision Zero, we're going to have to treat the system equitably and treat it with regards for safety first. And I'm concerned that that's not going to happen. I think CAV, connected autonomous vehicles, will get us partway there. I don't think it'll get us all the way there, and it's going to be a long transition period. I think as well, we need to take a look at how we're designing and operating the systems and make modifications as we go through. One thing that can help us as we get there is changing the cultural thought process where mobility is favored to safety is favored, and that's what we're going to do so that the country's investment scenarios follow that, and it follows it from a perspective of all modes are treated equally, and in some cases maybe even better to achieve those vulnerable road user reductions in deaths. And I think would be very, very appropriate.
Thank you, John. And with this, I want to thank all of our presenters for the excellent material that they shared with us today and the excellent discussion. But I also want to thank the members of the response team that they have been working in the background to make this a success. In closing, may I ask one last question to Patrick and turn it over to him, please, relative to what else is PIARC planning following this webinar. Patrick?
Yeah, thank you, Christos. Well, you're familiar with the disclaimer at this stage, I guess. Something I will mention, it's not on the slide here, is that at PIARC we have published a number of road safety related reports, and they are all available from our website for free, and usually in French, English and Spanish. So I invite everyone to go to piarc.org and download those reports and check them. There's lots of information there about vulnerable road users and credible speed limits, for example. They were prepared before the crisis, but they might be really relevant in our current situation. So next steps, we will publish video recordings and presentations from our webinars, including this one. Future webinars are planned, including a wrap-up webinar in English on the 29th of July. So we will share the registration link very soon for this one, and I invite everyone to connect 2 weeks from now. An in-depth report will complement the notes that have already been published, and it is scheduled to be available for September. You have here on the screen the link to our dedicated page on piarc.org, our website, where we collate all our webinars material, plus all information we have from our partners that could be applicable to PIARC members, roads, road operators, road administrations. The response team that Christos just mentioned, well, you can find our members here on the screen. Thank you very much to them. They have been really a great team since the end of March. And I also would like to add my thanks and really congratulate our panelists for their presentations, for their answers to the questions, and for their availability. Thank you very much. Our response team members' contact details are here on the screen. info@piarc.org. Basically, that's always a safe option. You can send a message there, and we will make sure to find you a person who can answer the question. And thank you very much for your attention, for your time, and I invite you to visit our webpage. Thank you to all, and stay safe.